Curious today of really looking at, what do you mean when you say respiratory muscle training? What would that look like? Is there some samples of it that we could share with the audience today of just something that generically is going to be healthier for them, and maybe how they could find somebody as well? Because I think of this as people that are dealing with musculoskeletal dysfunctions and at the same time aging dysfunctions of cardiopulmonary, kidney dysfunction, weight gain. How can we use breath training to be able to possibly put them in a better state than they are right now, even if their knees aren't allowing them to get out and just go for a walk? How could they do something while they're sitting in their home?
Yeah, no, it's a really good point. I think there are so many different ways that a person can do it. And I think, the example we started with, just in terms of taking several deep breaths to perhaps just improve the movement within the thorax, but also to improve the aeration of the lungs, to maybe bring a little bit more oxygen in and maybe a little bit less carbon dioxide to, or I should say more carbon dioxide to be exhaled, can certainly improve the system. But besides, diaphragmatic breathing and working with other breathing techniques, a lot of people over the past 20 or 30 years now have been using different devices that are oftentimes spring-loaded. They're little pieces of plastic typically that have a spring within it, and the spring pushes against an orifice that when you inspire, that orifice comes towards the mouth. The person has a resistance then set by that spring, and you actually have a bit of work now imposed upon the inspiratory or expiratory muscles that hopefully can improve the strength, that can improve the endurance and power, and allow the person to then have a greater maximal inspiratory pressure, a greater maximal expiratory pressure, that then, let's just say they do have obstructive lung disease and they are very weak and they can't really walk. One reason they can't walk is it might be the respiratory muscles are so weak and they can't breathe properly. And when they aren't breathing properly, the respiratory muscles, they need to continue to breathe. It's something we take for granted. But what will happen in the person with weak respiratory muscles is something called the respiratory metabolic reflex. And that reflex is due to weak respiratory muscles that are fatigued. They now need to continue to breathe. And so what happens is, to continue breathing and provide metabolic activity to the respiratory muscles, blood is stolen from the periphery and brought to the respiratory muscles. And now the person has less blood flow to the legs. They can't walk because their respiratory muscles are so weak. And so numerous studies have found if you can strengthen the respiratory muscles, there's less blood stolen from the periphery and the person can walk better. They have less shortness of breath. And it's the respiratory muscle training that I had mentioned where they do it maybe every day or every other day at a moderate to a high intensity. And they're very likely to improve strength, endurance, power, and just have better comfort when breathing.
Yeah. I really like that idea. And I think that's an easy way to teach it too. It's just, if your respiratory muscles, when we talk about respiratory muscles, the main one is the diaphragm. And then we have a lot of our abdominal intercostal muscles that aid and assist in that. A lot of it too, movement creates respiratory change, as we mentioned. That could give a break maybe to those fatigued muscles by just changing position a little bit. But it makes so much sense that there's a prioritization list in the body's homeostasis, right? So it's going to, breathing and heartbeat and brain are going to prioritize every muscle activity that there is. The blood's going to go there first. The oxygen's going to go there first, which means other parts of our body would fail or fatigue. And we see that in, sepsis. We see people in chronic disease where, we know when their kidneys and liver start to fail that it's not far from them having fatality if we can't get that reversed.